It's a pleasure to be here because I signed with my pen, but today we bring a shovel. We're going to start the work. I think it's the most important thing. The announcement that we did was very important, and I know for your community it's something very important because you have waited for more than 13 years, this project. The project will be the expansion of the hospitals. It's going to be at 10,000 square meters with a new expansion for 5,894 square meters for a new construction, and the other thing is going to be renovation of the prison hospitals. The cost of the project is $26.8 million. The ministry will bring $21.1 million. It's going to be $5.7 million that's going to be given by the hospitals, but of that there is a contribution for $2 million by the federal government. The most important thing is that we're going to increase the number of beds here in the hospitals. We're going to have 25 more long-term care beds, which is a lot needed, and also 5 acute care beds, new acute care beds. The most important thing, we're gonna build something that's gonna be a response to the needs of the population for the next 20 to 25 years. It's something that we want to encourage, that people are going to be treated close to their homes, close to their community. I want to felicitate, I don't know it's the good term to congratulate, thank you, Jeff, he's my English teacher at the Assembly. To congratulate the community because it's a project that you are planned since 1994. It's a project that we have waited for a long time, and I know they told me this morning it's a project that it has improved with the years, and it's something that we can congratulate you because I saw the plan here, and the new way that it's going to be is going to be more functional and it's going to be much better. Congratulations, and the date when it's going to be finished is going to be in June 2015. In 3 years, and you're going to see it's going to go very, very fast. Congratulations to all of you. Thank you very much.
It's very happy to be here today for this very important announcement, and my congratulations go to the community of Kahnawà altogether because you have a way of challenging the Quebec government in all that we do. Things are never easy. This hospital, I think, is maybe one of the only hospitals that has its own legislation before the National Assembly. So to do this expansion, we were required to present legislation. At that time, Dr. Bolduc presented it. I was the chairman of the Health and Social Service Committee. We had to get everyone together. We had to look at this legislation because this hospital is like, I can say this, unlike any other in Quebec because of its status, because theoretically, the health is a federal responsibility in a Native community, but because of the arrangement that started with René Lévesque, that has been continued by other governments, we have an arrangement where we are partners with you in building and maintaining this wonderful institution. And I think it's very exciting. I was talking with Linda DeLille and others this morning to be able to add 25 more long-term care beds. We know how important elders and the respect for elders are in Mohawk communities and First Nation communities in general. So it's a very happy event that we're here today. Linda DeLille was also explaining to me, but part of the new offer of services will be to reconnect with certain traditional activities and traditional medicine. And I think that's very important as well. Western medicine has many answers, but it never has all of the answers. So if there is a way that we can complement one with the other and we can learn from the Mohawk traditions and the Mohawk past, certainly in prevention, I think one of the key things that Dr. Bolduc, whenever I go to take the elevator in the National Assembly, and he says, "The stairs, Jeff, the stairs." And I say, "Yes, Yves, we'll take the stairs," but he's quite right, and I think if there are ways that the community can work on prevention, if there are ways that the community can work using traditional ways to keep people fit longer and healthier, I think everyone comes out a winner. So good luck with this project. You're in very good hands, and I'm sure that before long we'll be back to cut the ribbon and open up the important expansion to make sure that the Mohawks of tomorrow have the facilities that they need. I was talking to Dr. Jocelyn Sauvé from the Public Health Officer here on the South Shore, and she said what a wonderful partnership, and that the hospital here is very much part of the network of services here in the Montérégie. And I think that's important to highlight as well, that in many areas there's a great cooperation between Kahnawà and its neighbors, and that's a tradition that we have to continue. So thank you very much again. Thank you very much for bringing the good news, Dr. Bolduc, to Linda DeLille and your team. Good luck with this expansion project. Home renovations are never easy, but at the end of the day, we'll have a much better result for everybody. So thank you very much for allowing me to share this happy moment today.
I would like to take this opportunity to thank the Kahnawà community for their unwavering support as we've pursued the funding process. I would also like to thank the staff and management of the team of the Kateri Memorial Hospital Centre for all their efforts. This process has truly been a team effort. I look forward to the ribbon cutting ceremony, which will symbolize the completion of this renovated and expanded facility. Thank you.
Today marks another historic event for our community. For the past 12 years, the staff and management have shown their dedication and perseverance and has made the hospital expansion project become a reality. It's a proud moment for those who remember the hospital being built in the early 80s, and now once again we will see the transformation of the hospital, which will be monumental. In addition, it will also create much needed employment and highlight our workforce for the next 2 years. Now would be the time to encourage our young people to pursue a variety of careers in all areas of health care in order to fill the positions that will be created. We should be proud that once again Kahnawà continues to be a leader amongst First Nations in community development. I would again like to acknowledge the staff, management, and board of directors for their vision and dedication, and especially to Susan Horne, who has led this project wholeheartedly all of these years. Now go on.
Well, like the health minister said, you know, there's going to be a call for tender in the next few months. But right now, there's still planning going on, so more detailed specifications to the building, and so that'll take several months, and then there'll be a call for tender. So we're going to be out there looking for a general contractor. So 25 long-term care beds and 5 short-term care beds. So that's the biggest injection into the hospital. 2 new services, medical imaging, so x-rays, eventually down the road probably ultrasound, and traditional medicine. And the building that we have now is going to be almost renovated totally, because all the different departments are going to be moved around and relocated, expanded, and so it's quite a big job. Yeah. It'll be something that's going to complement what we do now. So the Western medicine, we know that our people have been for a long time practicing traditional medicine. So it's a way of saying yes to the community, that it's something that we need, people need it, and they see it as something that they need with what our doctors provide. So it's going to be a challenge. It's something that's going to be very new for us, but it'll be something to look after the whole person. It's going to, you know, add on to what we do now.
Well, it does feel pretty good, and it's basically the accumulation of all the years. My wife and Donnie Horne were initially involved in 1982 in negotiating with the Quebec government, getting everybody together. It took a while, but the agreement they referred to, the legislation that was passed, we initially drafted the agreement. We were successful because we kept all the lawyers out of it. We got the agreement in place and let the lawyers wordsmith the law, and as of today, this was the base of the agreement. It's a perpetual partnership, and what's really important is our hospital is owned by the Mohawks of Kahnawà in perpetuity. It's not incorporated, never will be. It's always going to be owned by the people of Kahnawà, and that's the fundamental principle. And we can negotiate federal and provincial governments, get them together to meet their responsibilities so that we meet the needs of our people. And it takes time. It's a very patient process. But as Mohawks, we're going to be here forever. So.
The legislation was changed in Quebec 2 years ago. Because of the work that was being done on the Mercier Bridge, we wanted to ensure that all of our community members were eligible to work on the bridge. With that, you know, there was concerns about CSST and MSI, the qualifications. So that took some time, but we have worked it out, and Currently, we do have community members who have gone through the qualifications process in order to be eligible to work on the bridge. What we're saying is that we know we have qualified workers from here, that they're equal to or better than what is out there.
In terms of what this is going to offer Kahnawà, in terms of employment, it's huge. In terms of taking care of our people, gigantic. 25 beds added to the current 33 beds is huge. So it's almost increasing by double. So that's a good thing. It's a much needed thing, and it's a great day for Kahnawà.